My name is Kim Hanson. I'm an emergency doctor. I live in Brisbane and work in Redcliffe. I've been involved with the Emergency Medicine Foundation that we know as EMF since 2018. EMF was born about 16 years ago. It's backed by Queensland Health, but an independent not-for-profit organisation that supports clinician-led research into emergency medicine in its broader sense. So that includes pre-hospital, retrieval, and everything that happens within an emergency department.
We want to deliver the best care we can to our patients, and that might be in enhancing our skills on the clinical floor, but the real value comes from being involved in creating the change and being a part of contributing to new knowledge and helping to develop and shape evidence-based practice for years to come.
What I'm proudest of is when I see a study that EMF was able to support and help those researchers conduct and publish, which people all over the world see and which can change practice not just in Queensland but around the world. I'm really proud of that and I think that's fantastic.
EMF awarded its first research grant back in 2008, and since then we have awarded almost $18 million to over 200 research projects.
EMF has funded millions of dollars of research, and we've had significant impact over that time. For every dollar that's invested in research, the health system will save about $50, and we've got data from EMF to show that. EMF supports projects that improve patient care, that saves lives, that enables patients to get back to work faster, that enables patients to be discharged rather than stay in hospital, allows them to stay in their rural or regional hospitals rather than being transported to tertiary hospitals. It enables our doctors and nurses to save time, to save equipment, to make the right diagnoses and the right treatment so that the patient gets the best care possible, but also as efficiently as possible. And of course, from an emergency department point of view, that enables us to quickly move on to the next patient who will be waiting to see us.
Queensland's emergency departments remain stretched with long wait times and health workers struggling to cope with demand.
Health Minister says a record number of people turned up at emergency rooms in the last year.
2.2 million, which is the highest on record.
So it's no surprise to anyone that our emergency departments are overcrowded. We know that more than 8 million Australians presented to an emergency department in 2022-2023. And that it's going up year in, year out. That growth does exceed population growth. More and more people have nowhere else to go when seeking urgent health care, and they come to our emergency departments. We also know that patients are coming who are sicker than ever before. Their needs are many and varied. It might be a heart attack, a stroke, but of course mental illness is increasing, eating disorders are increasing, trauma is always present. The people most likely to present are those at the extremes of age, so young children and our elderly, and of course they need a lot of resources, time and expertise to treat them well. And so emergency departments continue to struggle with the volume. Unfortunately, some people will wait a long time to be seen. But I guess one thing about emergency medicine is that we don't turn away anyone. So once you come into our department, we will see you at some stage and we'll give you the care and the expertise, the compassion that hopefully you need to get better. Most patients go home after an emergency department visit, but some do need to stay in hospital, and then we hope to point them in the right direction so they can get that care and then get back to their usual place of residence. The research that EMF funds is varied. We might support the care of children who need oxygen, for example, and at the other extreme of life, we're supporting older people to receive care in the community through mobile ambulances. So essentially a very experienced nurse or a doctor in an ambulance that goes out to their home to receive care that would otherwise be delivered in an emergency department, such as repairing a wound that needs sutures or treating a fracture. Through the $1.3 million invested, we hope to see improvements in the way care is delivered for Queenslanders going forward, and EMF has funded this research year in, year out for more than a decade now, enabling a whole range of improvements to be made. They've shortened the time that chest pain patients stay in emergency departments. They've prevented patients from being unnecessarily moved from regional centres to tertiary centres. They've enabled people with simple hand fractures to return to work faster. And all of these improvements just help keep us ahead of the curve, ahead of the wave of patients that continue to present to emergency departments. It's no doubt that without the EMF funding, our Queensland emergency departments and the patients who present to them would be worse off. We'll see these results from this lot of funding, this $1.3 million, over the coming years. But we know even right now, as we speak, because of that money, people are receiving care through innovative and novel ideas that our own doctors and nurses, paramedics or allied health practitioners have developed after working in emergency departments or in the pre-hospital area, and they've seen what can be done to improve care. So this is really exciting work that Queensland Health has invested in, that we hope to see continued investment, continue improvement, and it really puts Queensland on a good foot going forward into what is a growing population, an older population, and a world in which access to acute care can be difficult. One of the most exciting research projects, I believe, is Deadly Steps. That is a project that engages with the Indigenous community at around a medium-sized hospital to look at why these patients often leave without being seen, or they leave after the consultation has started but before it's completed. We know that Indigenous people have a shorter life expectancy and suffer illnesses greater than other members of the Australian community. So it's really important that us as emergency doctors, nurses, allied health professionals engage with the community and see what they need. And this is what Deadly Steps does. It's a co-designed model, so brings in community members to say, well, what do you need from the emergency department? And so what they're doing is greeting these patients in a culturally appropriate way, giving them information about how to access health care. And then if they do leave without being seen or leave before the consultation is complete, that team will follow them up and see if their needs have been met, if they've sought help elsewhere, or if they still need some more treatment. So that's a really innovative model that's already beginning to show promise. Another really exciting research project looks at the medication given to trauma patients as they're coming into hospital via the ambulance, to see would some additional medication just help their condition, would slow their bleeding and enable essentially more lives to be saved, but also amongst those that do survive, enable their survival to be faster. And so that's another innovative and exciting research project. A third research project that I'd like to talk about involves the older persons, involves the elderly, and essentially it's sending out a mobile emergency unit to an older person's home in Metro North to give them that emergency department care in their own home rather than bringing them into the emergency department. We know with older people that when they come to the emergency department, they're more likely to stay longer and they're more likely to be admitted. That's because of the complexity of their care. It might be their other medical conditions, it might be their social situation, their lack of support in the community, or their frailty. By sending a team out to their home and delivering that care in the home, not only is it easier for that person, not only is it faster, but it also enables that one-on-one care in a comfortable place for that person, prevents them having a long wait, a fall, catching infections in the emergency department or in the hospital. So that's another really exciting project that we've funded. Of course, there's a lot more. There have been hundreds of projects over the years, but I think those three from this year's awards are really exciting to watch.